What is it like selling into health systems in the middle of a pandemic?
It was interesting because I think we saw some partners say, you know what, we suddenly realized that this needs to get fast tracked and, really sort of jump to the table like we were, kind of taken aback. And others, said, oh, we're, completely caught off guard by COVID. We're really having difficulty getting organized and we're going to put this on the table. And so I think we saw it from both angles. And I think what's been really interesting is that providers have really started to see some of the impact of the behavioral health difficulties that people are having, the suicide rates, the isolation, the difficulty sleeping, some of the other struggles that are just really starting to be way more prevalent in the day-to-day stories that they're hearing. And they're not just hearing it from patients. I've been struck by one of the organizations we partnered with in New York, and some of the initial referrals were the providers. They referred themselves. And I've never in my entire career had that happen. And at first we thought they were just testing, like to see if the referral system worked. But I think that has been helpful. And I also think it's been really helpful to, talk primary care, to understand primary care, to really understand what their experience is right now. I think not having spent so many years working in and with primary care, I probably wouldn't have been as prepared to really partner with them during some of the most difficult times in their careers.